What's going on, everyone? Happy Labor Day. Happy Monday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and most importantly, I hope you are testing negative for all those viruses. It is time now for the Monday edition of the Virus Update for Labor Day, September 1st, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed of what's going on with them. COVID constantly keeps changing. Hey, flu season's right around the corner here in the United States. Flu season's already been happening in some parts of the world where it is winter, soon to be spring there, soon to be fall here in the United States. Hey, there's always something going on somewhere around the world. There's always new viruses. And, well, COVID never ended. That's where I come into play. I keep you informed of what's going on with these viruses. Want to stay informed? Subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. I want to welcome. We have a lot of new followers over the past few days. Welcome to my channel. I hope you stick around because, yeah, winter and fall, the cold season. I mean, it's Labor Day weekend, the unofficial end of summer. That means, yeah, everything's going back to reality. Summer vacations are ending. And unfortunately, right now, we are in a COVID wave. But before we talk about the COVID wave here in the United States, let's talk about New Zealand for a second. A new COVID-19 variant, XFG or Stratus, has been rising over the past 3 months. Of course, it's new to them. It really is still new to the world, but it's been around for a while now. And in some places, it's still rising. In some places, it's already dominating. Here in the United States, it's dominating. Well, the prevalence of the XFG variant over there in New Zealand is currently around 5% in June and to around 18% now. So it has been going up. New Zealand wastewater COVID-19 surveillance as of August 25th, 2025. Yes, you're still going to see some data from August. It's only the first day of September. That NB.1.8.1 variant, remember that one? If you've been around here for a while, you remember that. It's at 54.2% in New Zealand. XFG is at 18.3%. And there are a few others out there. Believe it or not, there's an MC.10.2.1 at 6.6%. And some other ones that are relatively old. All right, moving on now to this. Canada. I thought this was interesting. Dennis, the COVID info guy, once again. He posted this on X earlier. And get this. Canada average number of sick days taken by public health servants growing post-COVID. New data shows. Average sick days in Canada's public service rose from 5.9 in 2020 to 2021, remote work peak, to 8.1 in 2021-2022, 8.8 in 2022 to 2023, and 2023 to 2024, well, that's now up to 9.2. Yeah, that's going up there. Does the word long COVID ring a bell? And someone's probably going to post down below long vax. Look, here's my stance on that. I do recognize some people have had some complications with the vax. That's why I always say, you do whatever feels right to you. Do you want to get a vaccine? Fine. If you don't want to get it, well, that's totally up to you. And, yeah, long COVID, though, that is a very big issue that we discuss here a lot. Of course, I deal with long COVID, and my first bout of long COVID started in 2020, before I ever even had a COVID vaccine. So for someone who's going to say, "Ooh, stop getting that vaccine, you won't be so sick." Hi, 2020, I was infected. There was no vaccine for COVID at the time. It didn't exist. All right, moving on now to this. Here's the latest variant picture with a global scope to early August. Growth of XFG Stratus appeared to slow, so it slowed down a little bit. That's not good. Finishing at 58%. I mean, it's good that it's not growing anymore, but the fact that it's slowing, that means, well, there may be something else coming in the works, and we're starting to hear about a few more things. Before we mention any of that, the NB.1.8.1 Nimbus was fairly flat at 30%. I think we might hear about some of these other variants in this. I don't remember. Here are the threads across all the international traveler samplers, and XFG was a bit higher there at 61% when you do that. And then you come down to here. Yes, we're starting to hear about this. BA.3.2 variant arising from a chronic case with many mutations appears to be established in Western Australia now. This week it debuted in their wastewater analysis at 15%. It is possible that variant is driving the new wave there. Now, I want to stress something. What something does in one area does not mean, it's really taken off there. That doesn't mean that's going to be the next thing around the world. Sometimes we see these variants that just pop up in one area, they do something there, and, well, somewhere else, such as the United States, or maybe the UK, it never even does much of anything. It doesn't even come into a big perspective. We see this happen, where something ends up going on to dominate in one area, and it never dominates anywhere else. It's one of the many reasons why we constantly keep saying, there is so much we don't know about this virus, but yet everyone goes on and acts like, we know what's happening, when meanwhile, believe it or not, there are hundreds, if not thousands, of random little variants out there. And say, I don't know, a large number of people are getting the XFG variant, but you come along and get something that's a little bit more random that maybe not many people got, but for whatever reason, it's a little bit more severe. Yeah, it happens. That's why, another reason why COVID is different for every single person, because we're hardly sampling the cases out there. We get such a tiny sample of what's going on with these cases. That's why there's all these just random, unknown, what the variant does, subvariant out there. There's a lot of that. All right, moving on. Just going to read a headline here. COVID-19 cases surging again in Bulgaria. Doctors warn what's coming next. Yep. So another area which is reporting a rise in cases, a theme that we're seeing happening in many places around the world. All right. We mentioned the UK a little bit ago. We actually have some news out of the UK. First infant whooping cough death of the year has been reported in the UK. Yikes, that's not good. So, the UK is reporting a whooping cough death. Then we have this. UK also confirms H5N1 bird flu outbreak in southwest England. We haven't heard a lot about these in a while. And the UK, it's starting to pop up over there a little bit more frequently. Here in the United States, birds are starting to migrate south. I hate to even say this. I'm not 100% educated on how that works in the UK. Do you have a migration of birds in your area? If anyone's from the UK, let me know down below. Educate me. What happens with a bird migration over there? Because back in the spring here in the United States, when we had birds migrating north, we were seeing cases of bird flu. So I'm curious, how does that work over in the UK? Alrighty, moving on now to this. I posted a poll question. Hasn't gotten a lot of response, but hey, we'll take any response. This is just a very small sampling size on X. Are you or someone you know sick today? 41.8% said yes. 58.2% said no. That's out of 55 votes, and I didn't even specify if it's COVID or anything else. Are you sick today? Okay. All right, here's the website, datareport.info. Let's refresh this and see if we have anything new to talk about here. No, I'm not seeing anything right now. I did update some of the threads this morning, the tracking threads, and who knows, more stuff may pop up later today, which I doubt, though. It is a holiday. All right, moving on now. We talked about Canada a little bit ago. The viral activity level there for COVID-19 is moderate. Flu A is low. Flu B is low. RSV is in the low column or category at this time. All right, we do continue to see air quality problems across the western U.S. and, yes, some other regions as well, and you will see that. Take a look at this. Yeah, the West Coast, the Pacific Northwest, really bad air qualities. If you have to go outside in those areas, you may want to consider wearing a mask just because that is oh so bad. Look at Canada. We're seeing really bad wildfires once again. I'm concerned at some point this may make its way back to the east. Taking a look at what is going on with bird migration. Let's refresh this for today. Let's see how many million birds migrated from the north to the south. That's right, from the north to the south. Yeah, unofficial end of summer. Look at that. It passed over 300 million today. Almost hitting 400, not far from 400 million. Wow, it went over 350 million birds in migration, migrating south. Unfortunately for the colder months, the fall and winter is coming. Taking a look at this now. Pinellas County, Florida has been really bad today. I mean, really bad. There's been just a ton of calls today. I've seen sick person several times. Again, folks, we are now in September 1st. This is Pinellas County, Florida. We're talking about Florida here. Florida historically usually peaks for COVID in August, early to mid-August. We don't usually still see Florida doing really bad. Yeah, they're still coming down from the wave at this time of year, but this is really late. And I get it, the wave started late, but take a look at this here. You're also seeing elapsed time at the hospital. Yeah, 37 minutes, 35 minutes, 32 minutes. You're seeing a lot of calls here where ambulances are just waiting because the hospital's so darn busy, the emergency department's so busy, they're just waiting until a bed frees up so they can discharge their patient. That's not good whatsoever. Philadelphia yesterday, 788 EMS incidents. Let's see what's going on in the surrounding counties, which have been quite busy today. I've seen a lot of respiratory calls in Montgomery County. 2 right now. One point earlier, I think there were 4 or 5 at once. There's just been a whole slew of them today. Wow, look at this. Chester County, Pennsylvania. This is on a holiday. Sometimes holidays are slower, and if it's not really serious, well, they wait till the next day to call. You know how that goes. Respiratory difficulty, yeah, showing up there as well. Heart problems, a lot of falls. 1, 2, 3, 4, 5. At least 5 calls for falls at this time. That is rather interesting. Taking a look at what is going on when it comes to Bucks County, and we do see, yet again, respiratory distress is showing up. A lot of that. And take a look at this. Yeah, we haven't even hit to the day after the holiday, and already the hospital situation, you can see here, more yellow today. More than there was yesterday. Of course, the Pocono Mountains was absolutely mobbed with people this weekend. And you can see here, emergency department nearing capacity at St. Luke's Monroe. And then we come down to Lehigh Valley. There's a few problems there. Just one hospital in southeast Pennsylvania. And that is Bryn Mawr Hospital. Paoli Hospital is the actual name for that. That hasn't updated. All right, moving on. Let's see if there's any issues in New Jersey today. There were earlier. You can see Inspira Medical Center. Critical care has no beds, patient volume issue there, and that's the only one. There were 2 earlier, so they're down to 1 now. New York State, no update from there today. Now let's take a look at what is going on with emergency department business. This is the one. I hope we can load this. While we're waiting for this to load, let's pause and take that hydration break. Water is the drink of choice today. Yeah, I really wanted to show you emergency department visits diagnosed with COVID in all the different states. Oh, well, error loading. We know they're not going to fix that today. It's a holiday. CDC will be back again tomorrow. All right, we can switch gears here. Let's go over, let's do something unplanned here. Let's go over to variants in wastewater from COVID. We just saw that for New Zealand, and the thought came to my mind, hey, we can check that here in the United States. And take a look at this. XFG variant is at 71%. LF.7 is at 6%. Other. That is now at 23%. So, yeah, interesting. XFG is definitely dominating when it comes to wastewater. Let's take a look at some of these other ones here. Let's see what's going on with Mpox in wastewater. Are there any detections of that? And we are seeing a detection. Where is this at? Down in Harris County, Texas. There is a detection of it. And, I believe that is, yeah, that's the only place that's seen no recent detection. Yeah, it's the only place with a detection, but it's not a present detection. So it was recently, but not present at the moment. And it does say here, actually, 5 sites. I'm not seeing the other sites. Could there be one in California that I'm not seeing? Can we even zoom this map in? CDC. You need to really, your maps are, it's ridiculous. It's almost as if they don't want us to see the data. I'm trying to zoom in even further. You can't. You should just be able to just move this like Google Maps, and you can't. It's absolutely, totally ridiculous. All right, let's just go to some wastewater sites. This was planned. I want to go to wastewater scan now, and we'll just go to each region of the United States and do 2 to 3 wastewater sites. We'll start off with the Northeast first, and unfortunately the Northwest, I don't know how many we'll get to there because, as you know, wastewater scan does not have enough sites there. There's states in the United States that they don't even cover. And that really annoys me. Take a look at Newark, New Jersey. That was going upward. Then we saw a wonky downward movement. Don't know what that's all about. Influenza A has dropped a little bit. Influenza B is low. HMPV, look at this. That is seeing a little bit of a rise at this time. Hepatitis A is listed at medium at this time. Let's continue on here. Let's go further north into New England. Let's see what's going on up in Portland, Maine. Now, we're probably going to look at this again either later in the week or this upcoming weekend because They just had a holiday weekend, and I'm going to tell you this. I've been up there for Labor Day before. The southern portion of Maine gets pretty crowded for Labor Day weekend. Further north, from like Portland on north, believe it or not, at least I witnessed last year, was not as crowded. And I don't know if that's because people were infected or what the reason was compared to what I saw this year, or not this year, a few years ago at 4th of July, where I was absolutely mobbed up there. Yeah, Labor Day north of Portland. I don't know. It's just really weird. COVID level there, it is rather high. That's not good, and I suspect that's going to go up a little more in the near future. Influenza A is low, but you do see influenza A. It is starting to rise a little bit, and we're going to be starting to look for hot spots here and there. We've already seen norovirus hotspots. This is not one of them, but norovirus is rising slightly in Portland, Maine at this time. All right, let's do one more wastewater site in the Northeast. How about we come down to Harrisburg, Pennsylvania? Now, this is not a place where people travel for Labor Day, but nonetheless, school has started. Wow, look at that. August 13th, it really went up there, then dropped. We'll have to see if it goes back up again. Schools are opened back up now, opening up. Let's go to Winston-Salem, North Carolina. Surge continues there. COVID levels continue to rise at this time. Take a look at Alabama. Wow, we are seeing Birmingham, your entire Birmingham metro area. High, 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 and well, more high. Let's go down to, let's see, Village Creek. And in Village Creek, yeah, it's kind of bouncing around, but again, it's upward and it is high. And we are seeing hepatitis A, some detections of that there. Florida, we're not even going to click on a wastewater site in Florida. Pretty much all of them, except for one in Miami, are still listed high. Let's see what New Orleans is doing. We'll click on both of these wastewater sites, because there was one that was dropping. This is not the one. Okay, the Eastern Bank is still rising and is very high for COVID at this time. Medium for norovirus. How about the Western one? I know one of them was dropping. Did I get corrected? Oh, wow. Yeah. Oh, my. Wow. I did not click on this beforehand, so I'm just seeing this. And remember, there was one that was dropping. Well, that got erased and changed. And the Western New Orleans, wow. 2,000 pathogens. I mean, let's click on this for a second. For those who have been following this channel for a while, they know that they got hit hard in the wintertime. They had the Super Bowl. New Orleans has been hit hard this summer, and it just continues. That's crazy. I mean, you can see early on in summer, they had a really big rise, then that dropped, and now they're having a really big rise again. Sometimes there's no rhyme or reason as to why this is happening in certain areas. And can we get the data from there for variance? No, we cannot. Wow. West Bank wastewater site. If you know where that is, if you live near there, please take things very seriously. All right, let's go up to Michigan. Let's go up to Warren, Michigan, shall we? And, okay, this could get corrected as well. Now this, let's see here. 1, 2, 3, 4 updates. I think that's going to get corrected. But treat it as if it could be possible. And, yeah, you know the drill. When I say that, that means take COVID serious. Norovirus is listed at medium in this area. Let's go to another wastewater site in the Midwest. Let's go to Youngstown, Ohio. And COVID there is listed at medium at this time. No real big issues. Norovirus here is also medium as well. So that is a problem. Alrighty, let's just randomly continue on here. How about we make a stop in Louisville, Kentucky? Then we'll go down to Tennessee, and then we'll do a few West Coast areas. Louisville, Kentucky, medium for COVID. Norovirus is listed at medium. It is rising ever so slightly at this time. Now let's go down to Memphis, Tennessee. I wish we had wastewater in Nashville. Come on, you see a ton of tourism, and yet there's no wastewater here. I don't know if they even have a website. I'll have to check. It's just ridiculous that there's no wastewater for such a busy city. Memphis, medium for COVID, and going up ever so slightly. All right, let's head out to the West Coast and see what's going on there. How about we go out to Salt Lake City and see what's going on there. Salt Lake City, still high for COVID, still rising at this time. Norovirus also rising, and that is listed at medium at this time. And now let's go over to Las Vegas. Did a lot of people go to Las Vegas this weekend? I don't know. I'm hearing tourism in Vegas is the biggest drop in many, many years. Yeah. I don't know what that's all about. Perhaps maybe the pandemic never ended, or maybe it's another reason. Measles. You had that measles detection back in August. COVID at this time is listed at medium. Now let's go to San Francisco, California, and I see here that San Diego is back, so we'll look at that as well. Remember, we wanted to look at that several days ago, and we couldn't. San Francisco is rising slightly at this time for COVID. Still listed at high, and is that zoomed out? Yes, it is. So that's more than slightly. And it's rising quite a bit. That's not good. And then we go here to the other wastewater site. So we went to the western one, and now here's the eastern one. And we see that is listed high. And some Mpox detections at this time. You also had a measles detection back in June. You got a lot of things going on there right now. And let's go down to San Diego and see what's going on there. And in San Diego, we see COVID levels are on the rise at this time. EVD68 low, but has gone up ever so slightly. And it looks to me like everything else is fine. All right, somewhere in the Northwest, can we even do that? Yeah, we can. We can do Snohomish, Washington. Let's see what's going on there. I reckon that's still pretty high. Yeah, it is. It's high, and it is still rising at this time. Yikes, that is not good. Norovirus is medium and rising at this time, and everything else seems to be fine. We will end today in Idaho. How about Boise, Idaho? Can we take a look at Boise, Idaho? Sure we can, and both wastewater sites are coming in at high in Boise, Idaho. Let's go to Lander Street, shall we? Let's see what's going on at that one. Oof, yikes, that's still going up too. Norovirus continues to rise here. So they actually had a big rise in norovirus in August. Right now it's listed at medium. I don't know. Did they ever go to high? I think they may have. Just looking at that chart, they may have been listed at high at one point. And since we're here, let's look at West Boise, Idaho. West Boise, Idaho, that's high as well, but not seen as steep as a rise as we saw in the other portion of Boise. And norovirus is just starting to go up there, still listed at low at this time. Alrighty, folks, that does it for the Labor Day Monday edition of the Virus Update. If you enjoyed today's Virus Update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and, of course, leave your comments down below. Ways to support the channel are listed down below. I will see everyone again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Monday afternoon. Thanks for watching.